Hello friends, and welcome back to my YouTube channel. This is your friendly family physician, Dr. Rosie. Today's video is about some of the most common myths that I'll be busting about pregnancy. Obviously, being pregnant myself, I take a specific interest in these topics, so I've done the deep dive and all the research and all the evidence that's in there to bring you upfront and up to date with what we actually know in medicine, in science, in research, not just on Google and from your friends and from the blogs you've been reading. Before I start, if you enjoy this channel, please subscribe and share this video with someone who you think would enjoy and can learn from it as well. Let's get right into it. 8 of the most common myths busted. Myth number 1. So avoid ingesting specific foods like eggs and peanut butter and peanuts to avoid causing atopic conditions in your offspring, future offspring. False. What does that mean? Some people actually think that if they don't eat peanuts or they avoid milk and eggs, that their child won't have asthma, allergic rhinitis, or allergies. And this is like, there is no evidence or science to back this up. So eat whatever you normally would eat, obviously with the food avoidance that I mentioned in my previous video, but eat, general things you enjoy and don't have too much worry for your offspring. Myth number 2, eat for 2. You're pregnant, you're 2 people in one, so please eat for 2. False. As much as you may need an increase in caloric intake, which I'll get into, you don't actually need to eat for 2. So don't be eating 2,000 plus calories a day because you think you need it. You don't. And in fact, in your first trimester, you might even be like have an aversion to so many foods, be so up and caught with nausea and vomiting of pregnancy that you won't be as hungry. Normal. But eating for 2 is not indicated or suggested. What is suggested, once you reach it by first trimester, there's no indication for increasing your caloric intake. So eat what you normally would, okay? By the second and third trimester, yes, we suggest upping calories by 200 to 450 calories-ish per trimester. So 200 to 300 in the second, and then 300 to 400 in the final trimester. Now this goes for a previously healthy, meaning normal BMI, female. If their body mass index was between 18.5 and 24.9 prior to getting pregnant, then these are the caloric increases that they should follow. If you're not in that category, speak to your OB and get a bit more detail about what kind of food or how much more food you should have. Caveat, however, we say increase by 200 or 300. That doesn't mean you should have an extra slice of cake at the end of every day. We're talking about nutrient-dense food. So nut butters, yogurts, fruits and veggies, things that are going to be nutritious for your fetus, as we do have an increase in vitamin needs during pregnancy. Next myth busted, myth number 3, that breastfeeding will actually make you lose weight faster. No, not really. Here's the thing about breastfeeding. Although it has its many benefits, it really does. To name a few off the top of my head, less risk of breast cancer, future for that woman who's breastfeeding, less risk of fetal infections or baby infections, less risk of allergies in your child, all amazing things if you choose to breastfeed, and cool if you don't. However, what it does do is help secrete something called oxytocin, a hormone which in fact is involved in contraction of the uterus. The uterus is the home for your fetus for 9 months plus, and it's a muscle-based organ. It's an organ that has muscles, okay, that will contract on its own over a certain period of weeks. I believe it's about 12 in someone who's not even breastfeeding, meaning it'll come back and resume to its normal size, but that'll happen quicker if you are breastfeeding because of that oxytocin, which is causing more contractions. Painful, but true. So you might have a flatter tummy sooner, but you won't actually lose weight. That in mind, you actually might need more calories and nutrition to compensate for the breastfeeding. So you may even gain some weight depending on how much and what you're eating while breastfeeding. Myth number 4, you should avoid exercising while pregnant. Now, we've come a long way since like old school mindset and thought process and views of pregnancy. And I'm sure many of you have actually seen super active women who are pregnant. So here's the thing, false. If you could be active, amazing. Meaning if there are no contraindications, and there are some to some pregnant women, and your OB should be able to advise you of that. But if you have none, and no one's told you not to exercise, then if you've previously been someone who exercised, it's a good idea to continue, maybe not at the same intensity. So I won't get too deep into the specifics of pregnancy and exercise, but staying active actually makes for a better chance of a healthy delivery, less risk of gestational diabetes, and less risk of preeclampsia or hypertension during pregnancy, all these awesome things. Now, if you never exercise, don't wait till pregnancy to start training for a marathon. Not recommended. But if you normally exercise, then maintaining some kind of physical activity, 150 minutes a week, ideally, of mild to moderate intensity, is a really good idea. Do not be involved in contact sports, so no boxing, no kickboxing, shouldn't happen. And try to keep, I don't say specific heart rate, but your breath should be able to maintain a discussion while you're active. So to heave and be out of breath during the exercise is not the goal, but to be able to kind of still be able to get words out while exercising, well, that's kind of how your fetus feels. That's how I counsel my patients. That's how I've been counseled as a patient, and it seems to have worked. Myth number 6: we cannot get manicures and pedicures while pregnant. Although I really need one. False. Now, caveat or a little disclaimer, so many of these mundane subjects are very understudied, so it's really based on the little evidence that's out there. But like I said, I did my research, and this is the evidence that's out there, as little as it is. It's not anecdotal, it's not just storytelling, it's really what we recommend based on the proof and the science. So mani pedis are cool, it's chill. There's no actual absorption of the chemicals. Now, that in mind, you should be in a ventilated place to avoid inhaling some of the chemicals. That's what's recommended. If you can go natural, cool, but don't worry about risk to your fetus. There's no evidence that it's actually linked to birth defects. The chemicals that may be contained are like formaldehyde, toluene, and toluene. I don't even know if I'm pronouncing that well, but these are the chemicals that could be in nail polish that people think are dangerous, but with good ventilation, there's no risk on your actual fetal development. Next myth, number 5: you can tell your fetus's gender by their heart rate. No evidence proves this. Bottom line, if your heart rate is 160 or 110, it simply means your child is healthy. They may be a bit more active or less active at that moment, but it doesn't mean they're either a boy or a girl. So gender is not revealed by fetal heart rate. 7th myth debunked. You can't dye your hair while pregnant. Well, luckily for you, you can. However, be prudent. So, there's very little evidence that very much of the chemicals or the dye is actually absorbed in a healthy scalp, right? Not one that's like cut up and torn. So if you have a healthy, intact skin of your scalp, chemicals should not be so much absorbed. That being said, if you want to be super safe, then using plant-based dyes are the move. And anything that is ammonia and peroxide based, avoid that. Now, if you can't, you absolutely want to use it, also okay, but ideal, because there's so little evidence around it, to avoid it in the first trimester when the fetal development is happening, and kind of push it off to the second and third trimester. That's all we recommend. Also goes without saying, a well-ventilated place, so don't do it in your little 2x3 bathroom that has no windows or fans. No, you want to do it in a place that's well ventilated so you're not inhaling all of this as well. 8th and final myth debunked: facials are a no during pregnancy. Yes and no. Facials, so as much as people think there's this pregnancy glow and all women have it, that is not true. Many women have severe acne, discoloration, a specific rash that looks kind of like a sunburn. Anyway, very common. It's called pregnancy rash, and wanting to have skincare and facials done is absolutely normal and understandable. But things to avoid, I will mention them to you today, just so that when you see your facialist, you can tell them, hey, I'm pregnant, and they should know anyway automatically to avoid these chemicals or products, ingredients. Retinol, retinoids, absolute no. And I've spoken about this in a previous video, but it's a no once again. Vitamin A derivative, fetal evidence that it causes fetal damage and malformation. So no retinol, retinoid, chemical peel or other. Other thing is salicylic acid. So under 2%, okay to use, especially as a wash off, but not as a chemical peel where it stays on the skin for a long period of time. So that's that. Other chemical peels that are okay are lactic acid and glycolic acid based. Under 20% though, which is a typical office peel, right? So less than 20% office peels. Again, whoever's providing this with you should know this already, but just so you know, glycolic and lactic acid are safe. Retinol, retinoids are not safe, and salicylic acid as a wash off under 2% is alrighty. Other thing you can also use is azelaic acid. Also, another thing not to use is hydroquinone. So I'm not going in all the details of skincare during pregnancy, but plus ou moins you get the point. What not to touch and what to advise your facialist about. It's about it. It's about it, friends. I hope your journey during pregnancy is going well, and I hope that this evidence and these facts is helping you get through it more mindfully and more confidently as you make your decisions on a day-to-day basis. It's a tough period, or challenging, or new, and the more we know, the more we feel safe and secure in our decision making. So I hope this evidence provides you with some security. And that's about it. Again, if you enjoyed this video, please subscribe, like it, and share it with someone who you think can learn from it as well. Till next time.